Hi, hello, welcome back. So today we are again with a new video content. It's all about ICD-10 CM guidelines, chapter 15, which is completely related to pregnancy. Okay, so pregnancy guideline is an important guideline which is asked during the time of interview as well as in the CPC exam also. In ICD questions, you will get a question from pregnancy, and most of us will think like it's little bit long. Okay, so we might have a fear like it's a very big guideline, so it will be difficult for us to understand like that. Nothing like that. It is very simple and very easy to understand also. It's everything about our interest to learn. Okay, first of all, you should create or you should have a mindset like I want to learn this, I want to know more about this, like that. A mindset you have to create yourself. Then you enter into the course and start studying. It will really help you, what to say, it will really help you. And it is like when you take this ICD-10 CM guidelines, no, it is very interesting to learn as well as very interesting to work out the question also. So you can make a note of all the guidelines whichever I'm posting here, so that it will really help you to prepare for your interview session as well as if you're preparing for your CPC exam also, it will be helpful. And before entering into the video, let me introduce myself. I'm Danya. It's for new viewers who are watching me for the first time. Okay, I'm Danya. I'm a CPC certified trainer. Basically, I'm giving training for CPC certification as well as basic medical coding training also provided, and we do provide placement assistance also for the candidates who have cleared the training and who have cleared the CPC exam also. And then if you haven't subscribed my channel, please do subscribe, and if you find it useful, please do share it with your friends also. After watching this video, if you have any doubts, you can put it as a comment, and if you have any suggestion or if I have missed any points, you can add that in comment also. Okay, so making sure that it will be what to say, the video is made in a simple way so that you can clearly understand and make use of it. And one more request I have, like by listening only the guidelines, it won't help you much. What you have to do is, after completing one chapter guidelines, you have to do at least 50 to 100 questions from that chapter, how to implement those guidelines. So you have to do worksheets, then only you will understand like, okay, this should be the primary diagnosis in this scenario. So if I get a question, I have to assign this as a primary code, this as a secondary code. If you should understand how to implement that, you have to work out the question, then only it will be helpful for you. Okay, so make sure you're taking note of all the guidelines whichever I'm posting, and study it at least 1 or 2 times, and make sure you're clearly understanding it, and don't forget to work out questions also. So come, let's enter into the video, and don't skip the video in between. In this chapter 15 is little bit elaborate, so almost 50 slides or something is there. So make sure you're watching each and every slide properly and you're taking note also. Okay, so wish you all the best if you're preparing for your CPC exam or if you're preparing for your interview, anything. Wish you all the best, wish you all success in life. Okay, so don't skip the video. Let's enter into the PPT. Thank you. Hi, hello, welcome back. So today we are starting with ICD-10 chapter 15, that is pregnancy, childbirth and puerperium, O00-09A code series guidelines. So previously we till chapter 14 we have completed all the ICD-10 CM guidelines, and I have created a playlist for this also. If you haven't watched it, please do watch. So we'll start with chapter 15. The first guideline is code from chapter 15 and sequencing priority. So for chapter 15, codes ranging from O00 to O9A is completely for pregnancy, childbirth and puerperium. Chapter 15 codes have a priority over all the codes, and additional code from other chapters may be used in conjunction with chapter 15 codes. The pregnancy is incidental to the encounter. So what does it mean? Pregnancy state incidental. When a pregnancy is incidental to the encounter, means that Pregnancy is not the reason to visit or for the treatment, but the patient happens to be pregnant. The ICD-10 CM guidelines provide specific instruction, like the patient is going to the hospital for some other condition. Later she is coming to know that she is pregnant. For this, the primary diagnosis will be the code for the condition, that is the reason for encounter. She has come to the hospital for some other condition, right? That should be the primary code. And second code should be from Z33.1, that is pregnancy state incidental. Because after going to the hospital only, she is coming to know that she is pregnant. Next, chapter 15 codes are used only on the maternal record. Chapter 15 are used only on the maternal record, never with the newborn record. So O series and P series should not be coded together. O series should be coded only for pregnancy condition, and P series should be coded only for newborn condition. Next comes final character for trimester. Final character for trimester indicate during which the condition has occurred. Trimester indicates the final character by, if it is first trimester, you have to add 1 in the 7th character, which means less than 14 weeks. And second trimester, the 7th character will be 2, which means 14 weeks less than 28 weeks. And third trimester, the 7th character will be 3. Next, selection of trimester for inpatient admission that encompass more than one trimester. When a patient is admitted in the hospital for in one trimester and she is getting discharged in another trimester, in this case you should take only admission trimester into consideration. Don't check for the discharge trimester, only admission trimester is possible. Next comes unspecified trimester. So unspecified trimester means it is important to identify the correct trimester, but if it is not specified, you have to assign 0 in the 7th character for unspecified trimester. It's a very easy guideline only, okay. Next comes example for coding unspecified trimester. If a pregnant patient is seen for a condition like nausea that isn't linked to a specific trimester and the trimester is not documented, here you will be using O21.0 mild hyperemesis gravidarum with 7th character 0, which indicates the trimester is unspecified. Next is 7th character for fetus identification. As we told, all the 7th character will be indicating about the trimester, but there are few codes, that is O31, O32, O33.3 till O33.6, O35, O36, O40, O41, O60.1, 60.2, 64 and 69. For these codes alone, the 7th character will tell you about the fetus identification. If there is only one fetus, you have to give 7th character as 1. 2 fetus, use 7th character 2. 3 fetus, 3, 4 fetus, 4, 5 fetus, 5. And if more than 5 fetus is present, 7th character should be assigned as 9. So when to use 7th character for fetus identification is given here. Please read and see. Next, complete week of gestation. In ICD-10 codes for a complete week of gestation, we have to use Z3A point dash. The dash will indicate the weeks. So Z3A codes completed week of gestation starts with Z3A.01 till Z3A.49. These codes ranges from Z3A.01 less than 8 weeks till 49 weeks. How to apply the Z3A codes? Determine the completed weeks. The key is to document and code the number of completed week of gestation. For example, a pregnancy 28 weeks and 3 days. Here we have to code it as Z3A.28, mentioning that is the patient is 28 weeks pregnant. Here I have given an example. A patient at 32 completed weeks. You can check that example and see. Selection of OB principal diagnosis. Routine outpatient prenatal visit. A pregnant patient is coming for a monthly checkup, that is called as routine outpatient prenatal visit. For that we will be coding Z34, encounter for supervision of normal pregnancy, and that will be the primary diagnosis. These codes should not be used in conjunction with other chapter 15 codes. Next is supervision of high risk pregnancy. A high risk patient is coming for a monthly checkup, then you will be coding O09. This category is specifically designed for pregnancy where there are potential complications that put the mother and fetus both at risk. For routine outpatient visit of high risk patient, you will be giving O09. And here I have listed the codes here, O09.0 till O09.9. Please read each and everything and see like which are the condition considered to be high risk pregnancy. Next comes episodes when no delivery occurs. The patient is pregnant and she is coming to the hospital for a complication that is due to this pregnancy, and by checking the complication there is no chance of delivery. So here the patient is coming for a complication but delivery has not happened. So in this case, first you have to code complication, reason for admission, and second you have to code for week of gestation. Second guideline, when delivery occurs, here the patient is coming with a complication to the hospital and immediately delivery is happening. In this case, first you have to code for reason for admission, second you have to code for delivery, whether it is normal delivery or cesarean delivery, that you have to code. And whenever you are coding for delivery, next code should be assigned for outcome of delivery. Example, a 28-year-old female is admitted for a labor, 39 weeks of pregnancy. She has spontaneous vaginal delivery of a healthy baby boy. The pregnancy was complicated by gestational hypertension. So first you have to code for delivery code, second you are coding for gestational hypertension, third you are coding for outcome of delivery. Outcome of delivery is Z37 point dash. Z37.0 indicates single live birth, Z37.1 indicates single stillbirth, Z37.2 twins both live born, Z37.3 twins one live born and one stillborn, Z37.4 twins both stillborn, Z37.5 other multiple birth all live born, like that you can read and see. Next is pre-existing condition versus condition due to pregnancy. Pre-existing condition means what? That condition that occurred before pregnancy itself, and condition that developed due to pregnancy, that is after pregnancy. Pre-existing condition, these are medical conditions that the patient had before becoming pregnant. When coding, it is important to identify whether the condition was present before the pregnancy or was happened during the pregnancy. Condition due to pregnancy, they are the conditions that arise because of pregnancy and are typically classified under O00 to O9A. Examples, gestational diabetes. This is diabetes that is occurring during the pregnancy. So you are giving O24.4. Preeclampsia, that will be coded as O14 point dash. Next, pre-existing hypertension complicating pregnancy, you will be coding O10.9, and gestational hypertension without significant proteinuria, you will be coding O13.9. Gestational diabetes diagnosed during pregnancy, you will be coding O24.419. So these are the things which you must be very, very clear. Pre-existing hypertension in pregnancy. The code series O10 indicates pre-existing hypertension that is complicating pregnancy. When assigning one code of O10 series, that includes hypertensive heart disease or hypertensive CKD. So it is very much important to assign a secondary code from hypertensive heart disease or hypertensive CKD or hypertensive heart and CKD. I11, I12, I13 series are there. So secondary code will be assigned from that. Fetal condition affecting the management of the mother. When coding for fetal condition affecting the management of the mother, it is essential to identify how the condition of the fetus impact. Okay, so code from category O35 and O36 is given. O35 indicates maternal care for known suspected abnormality of the fetus, and O36 is unknown. In utero surgery, in case when the surgery is performed on the fetus, inside the uterus, that is called as in utero surgery. For that you will be coding from O35 series. No code from chapter 16 should be used along with this O35 or O36 codes. Next comes HIV infection in pregnancy. This we studied already in chapter 1 itself. Anyways, I will revise it again. So, if a pregnant patient is having HIV, first you have to code for HIV complicating pregnancy O98.7. Second, you have to code for HIV. If the HIV is asymptomatic, you have to code Z21 instead of B20. Next comes diabetes mellitus in pregnancy. Diabetes mellitus is a significant complicating factor in pregnancy. Pregnant patient who are diabetic should be assigned code from O24, first code O24 point dash, diabetes mellitus complicating pregnancy, and second code you should code for type of diabetes, and third, if the patient is taking insulin, you can code insulin for diabetes mellitus in pregnancy, because this diabetes is already pre-existing condition. Okay, and then gestational diabetes. Gestational diabetes means pregnancy induced diabetes. After getting pregnant, that is in the second or third trimester, if she is getting the diabetes, that is called as gestational diabetes. For that you will be coding O24.4. Here you have to keep one thing in mind. Gestational diabetic patient taking any drugs, insulin or oral hypoglycemic drug, that should not be coded along with gestational diabetes. Abnormal glucose tolerance in pregnancy. When a woman is pregnant, sometimes her body doesn't handle sugar as well as it normally would. In that case, it is called as higher than normal, that is called as abnormal glucose tolerance. For that, you have to code O99.81. This is because of due to high intake of fruits or carbohydrates, or normally her sugar level will be high. When we maintain a proper diet, it will come to normal. Next comes sepsis and septic shock. So, when a pregnant patient is affected with sepsis, that should be coded as puerperial sepsis. So, first code, you should code it as puerperial sepsis O85 point dash. Second, you have to code for organism B95 or B96. Third code severe sepsis if it is mentioned, severe sepsis with or without septic shock, and fourth code for organ dysfunction if it is mentioned. Next comes alcohol use during pregnancy, childbirth and puerperium. First code for alcohol use complicating pregnancy, that is O99.31, and second you have to code for alcohol related disorders from F10 series. Next comes tobacco use during pregnancy, childbirth and puerperium. Primary code or first code will be for tobacco use complicating pregnancy O99.33, and second you have to code for nicotine dependence from F17 series. Next guideline is tobacco is already, I told you, no, I think mistakenly the slide has been repeated again. Sorry for that. So make sure you are writing all the guidelines in your notebook and keep revising those guidelines if you are seriously looking for medical coding profession. So it will be easy for you to understand all those guidelines. Next comes drug use during pregnancy. First code drug use complicating pregnancy O99.32, and second you have to code for drug use that is F11 to F16 and F18 to F19 series of codes. It is very simple. So next guideline is poisoning, toxic effect, adverse effect and underdosage in pregnant patient. First code you have to code from O9A point, that is whatever poisoning or toxic effect which is complicating pregnancy, you will be coding O9A.2 dash, and second you have to code for injury, poisoning, toxic effect, whatever it is occurring, that should be given as a secondary code. Next, if the patient is getting admitted in the hospital only for normal delivery or cesarean delivery, first code should be for delivery. And I already told you, whenever we are coding for delivery, additional code should be given for outcome of delivery is at 37 point dash. Next guideline is Peripartum. Peripartum period is the time surrounding childbirth, including just before, during and immediately after the birth. Peripartum. Peripartum, when it is starting a few weeks before labor begins and includes the entire labor and delivery process and ends up to 24 hours after the baby is born. So it starts in the last trimester of pregnancy and it will be continuing till the baby is born. Postpartum is after delivery up to 6 weeks, that is called as postpartum period. This is a important interview question also, so make sure you are studying it properly. What is peripartum and what is postpartum? Next is admission for routine postpartum care following delivery outside the hospital. So delivery is happening outside the hospital, maybe at home or in the car or in the bus, in the travel. Delivery is happening. The patient is coming to the hospital only for postpartum care. For this, the primary code will be Z39.0. Encounter for examination of mother immediately after delivery. Next comes pregnancy associated cardiomyopathy. Pregnancy associated cardiomyopathy, the code series O90.3. So pregnancy associated cardiomyopathy is diagnosed in the third trimester of pregnancy and continues to few months after delivery. For this we will be coding O90.3 as a code. Next one, sequelae of complication of pregnancy, childbirth and puerperium. So already we have studied this. What is sequelae? Sequelae are the long term effect of the condition that results from the previous disease or a injury. That is called as sequelae conditions. For example, if a woman had a severe infection during childbirth, later it develops into a chronic pain because the chronic pain is considered as a sequelae of the childbirth. So how to code sequelae? First we have to code the current condition for what the patient is coming to the hospital, and second code you have to code for the reason why the first condition has occurred with the seventh character yes. Example I have given here, please see that example also so that it will be easy for you to understand. Next comes termination of pregnancy and spontaneous abortion. Termination and spontaneous abortion both are considered as abortion only. So first guideline is abortion with live-born fetus. When a patient is coming for elective termination of pregnancy and a baby is born lively, first you have to code for elective termination or pregnancy, and second you have to code for outcome of delivery. Next comes retained product of conception, RPOC. Retained product of conception refers to the tissue remaining inside the uterus after the abortion. So for this retained product refers to the tissue remaining inside the uterus after an abortion, maybe spontaneous or induced, that can cause complication like infection, bleeding or other issues. So first we have to identify the type of abortion. The primary code will be for the abortion, and if they are repeating the abortion again, you have to code for the elective termination of pregnancy as a secondary code. So here I have given an example for this. You can go through it and understand how the code is being assigned. Pregnancy chapter is a very simple chapter only and it is easy to understand also. Then comes hemorrhage following elective abortion. For hemorrhage post elective abortion, we will be assigning O04.6, that is delayed or excessive hemorrhage following induced termination of pregnancy. Here we have to note one thing, that is we should not assign O72.1 other immediate postpartum hemorrhage, as this code should not be assigned here. Next comes abuse in a pregnant patient. We have three types of abuse: physical abuse, sexual abuse, psychological abuse. For physical abuse you have to code O9A.3, sexual abuse you have to code O9A.4, psychological abuse O9A.5. Out of three, anyone will be the primary code, followed by the appropriate code to identify the current injury due to the abuse, and if the perpetrator is found, you have to code for the perpetrator code also. COVID infection in pregnancy. During pregnancy or childbirth, when COVID-19 is a reason for admission, first we have to code O98.5, that is other viral disease complicating pregnancy, and second you have to code for COVID-19, that is U07.1. If the reason for admission is unrelated to COVID, but the patient is tested positive for COVID, first we have to code for the reason for admission. Second, you have to code for O98.5. Third, you have to code for COVID-19, U07.1 as a code. So that's all about pregnancy chapter guideline. If you have any doubts, you can put it as a comment also. And if I have skipped anything, you can add that thing also in the comment. So thank you so much for watching. Thank you for your time and wish you all the best if you are preparing for your CPZ or interview. Wish you all the best, and if you haven't subscribed, please do subscribe my channel. Thank you so much. Take care. Bye bye.